Hello, my name is Katya Ringler, and it is July 23rd, 2023. Here is this. And this will be my submission for the Case Connection 2 assignment. So for this assignment, I began with case number 2. This looked at the regulation of glucose between normal cells and tumor cells, which was shown through this picture. The first part of this question, we analyzed what glucose uptake looked like in normal cells. So, glucose uptake can be insulin sensitive or insensitive. Insulin is secreted in response to a high blood glucose levels. So, when they consume the glucose, their blood glucose obviously raised. In our adipose tissue and our skeletal muscle, we express glucose transporter 4, which is sensitive to the hormone insulin. Therefore, the uptake of glucose is controlled by this cascade that's activated by the binding of insulin with its target cells. And then the brain and the liver, they express an insulin insensitive glucose transporter. So GLUT3 is expressed by brain cells and GLUT2 is expressed in liver cells. GLUT3 uptakes glucose with high affinity, whereas GLUT2 has a low affinity for glucose. Now we're going to be looking at the glucose uptake by tumor cells and how this compares and differs from the normal cells, which we just went over. So this is all summarized by the Warburg effect, and this just kind of details that glucose uptake by tumor cells is increased compared to the glucose uptake in normal cells. To survive, tumor cells change their metabolism and require a constant supply of energy. And then so the tumor cells, they have a higher rate of glucose uptake, which is through glycolysis. And this consequently produces lactate, which is unlike normal cells as they have a lower rate of glycolysis and they oxidate pyruvate. So the modifications that we see so that these changes happen can be described through their expression of more GLUT proteins compared to normal cells. This allows them to optimize their energy supply and increase their rate of glycolysis, which I just mentioned. And then in addition to this, cancer cells also aerobically metabolize glucose. So even in the presence of oxygen, cancer cells convert pyruvate to lactate, which is different than normal cells where they oxidate pyruvate. And these modifications just support that the change in glucose uptake between normal tissue cells and tumor cells is that there is an increase in glucose uptake. So that is the summary of case number 2. And then for my third case, this was looking at muscle glycogen phosphorylase deficiency in a 16-year-old girl. This case was set up by question and answer format. So the first question was, I really like to take long walks. Will I still be able to do this with my friends? So to answer the patient, I found that the answer was yes. But I would respond in this manner. So be aware that there may be some pain at first. Muscle glycogen phosphorylase deficiency causes exercise intolerance, which is displayed by symptoms of weakness, fatigue, and cramps, which happens when you're doing anaerobic exercise. Now, walking is an aerobic activity. However, usually all exercise will begin as anaerobic. So when you begin walking, your body will enter the glycolytic pathway to produce energy, or ATP. And because your muscles are not able to convert that glycogen needed to become a glucose, you might experience pain here. So after a few minutes of exercise and that pain occurs, you might find it helpful to rest shortly and then proceed on your walk. So once you continue, the pain should be gone. This is a common condition. This is a common experience for people with your condition, and it is called the second wind phenomenon. This is when the bodies switch over from the glycolytic pathway to the oxidative phosphorylation. Um, so walking is an aerobic activity, which is often prescribed to people with this condition. So um, it's super important to maintain health and strength, and doing regular gentle walks has been a way to support this. The second question the patient asked was, do I have to worry about having reduced muscle glycogen stores? My answer to this question is yes. And why? Our muscles need glucose. So when you consume carbohydrates, you're increasing your supply of glucose in your blood. The extra glucose gets converted to glycogen so that it is stored and can be used for later. Glycogen is stored in multiple places, such as your muscles, which is what we're looking at in this case, and is crucial for maintaining a steady supply of glucose to the muscles. Muscle glycogen phosphorylase is the enzyme that's responsible for breaking down glycogen when glucose is needed by the muscles. So, deficiency of this enzyme prevents glycogen from being used for the energy. Now, the third question the patient asked was, as a result of this deficiency, will I need to get up at night to maintain my blood glucose levels? The answer to this question can be summed up by the process of glycogenolysis. This is the major source of blood glucose during an overnight fast, so during the nighttime. Therefore, it is important to make sure that you have an sufficient carbohydrate intake. This is crucial for preventing low blood sugar. So this can be achieved through consuming cornstarch every 3 to 4 hours and then supplementing this obviously with a carbohydrate-rich diet. So during the nighttime, you might find that that's going to be um, within that time frame, that 3 to 4 hours. Now, you you want to choose cornstarch because it maintains your blood sugar levels for longer. This is because it's a complex carbohydrate. And for the last question for the patient, they asked if I need to worry about producing excessive lactate during intense anaerobic exercise. I found that the answer to this question is no. Now, why? Lactate levels will remain the same or they might be decreased based on the amount of glucose in your blood. So during anaerobic exercise, glucose is converted into lactate, and then the glycogen stores are used to fuel anaerobic exercise. So, therefore, individuals with the deficiency of muscle glycogen phosphorylase will not be able to contribute their excess glucose. So, this condition limits both your anaerobic and your aerobic exercise capacity. People with this condition often find that it is hard and very tiring to do intense anaerobic exercise or strenuous exercise for more than just a few minutes. Um, that's why walking is typically preferred for the exercise for patients like this. They're able to do aerobic exercise for more than 8 to 10 minutes. So, all right. And then just this last slide is going to be all of my references that I used for this assignment. I used 7 different references. Some were from our lectures and the study guides used in there, and then I found some articles, of course. So you will find them in text or at the bottom of the slide. So thank you for listening, and I hope you learned a little bit more about this information. Thanks. Bye.